This is the UR Business Network.
Let's use our job board too.
Inshallah. Yeah. So we were actually specifically drawn to it because of the focus on the Arab world, and specifically around the fact that we saw a good opportunity to talk about what we would consider one of the emerging kind of epidemics of sorts, and that is the prevalence of diabetes and the complications associated with diabetes throughout the Middle Eastern region, which happens to be even much worse than in the developed world. So we thought there was a good opportunity to get those discussion topics out on the table and have some good discussion around it. I think there was a pretty good panel set up for that.
Just to add to that, I believe we look at it from a very holistic approach to manage diabetes. So it's not about the pharmaceutical industry or about the healthcare professionals. It's about a collaboration across the board. And I believe this was an excellent opportunity to try to facilitate that discussion.
So I would say that, first of all, it's a very complex disease to treat, especially in the Middle East, where you actually have kind of societal issues you're dealing with because of the sedentary lifestyle, the emergence of different types of fast foods and foods that are not traditionally local to the society there, along with the fact that you don't have the education necessary to get people to understand the severity of the disease, and this emergence of obesity, even in the childhood area where you actually have much more childhood obesity. So all of that is kind of a cocktail that is actually brewing to create more prevalence of diabetes. And like I said, in the Middle East, especially in the Gulf states, where there are more affluence there, is that it's almost 20% plus. So it's among the highest in the world as an emerging problem and threat. So there's quite a few challenges. You don't have as many practitioners who are specialized in management of diabetes. You don't have the type of infrastructure for media support with regards to getting the word out that these are important diseases to be treated. You don't have necessarily societal infrastructure within the family unit to be able to know that these are good things like exercise, managing of weight, managing of all the things that you're eating to get to actually be a better case going forward. So these are just some of the challenges that we face.
I also want to highlight the major challenge about diagnosing patients. So if you actually look at the epidemiology and look at how many patients have been diagnosed, there's still 50% of patients not diagnosed. So they do not know that they are actually diabetics, and therefore they don't take any actions from diet, from exercise, etc. So that's a major challenge that I think needs to be addressed as well. So as I said before, I think this is a holistic approach. So this is not one single entity that can address this. So it's about, first and foremost, education. It's education for healthcare providers and for families. So that needs to be addressed, and I think we need to do that together. We as MSD, we are very happy to participate in that kind of approach. Just to mention one example, in the Middle East region where they have the Ramadan, so we have put out a cookbook on how you can manage your diet during that fasting period. And you see a lot of hypoglycemia incidents during that period because people don't eat, from sunrise to sundown, and that is a major challenge for diabetic patients. But it's about education first and foremost.
Yeah, I agree. I think there's nothing much to add. I think it's all good points. No, we appreciate actually being here, and we actually have great hopes the fact that we've at least started some discussion. And this is discussion people have been having for some time now. This is not new. But the issue needs to be much more discussed at a level whereby governments start to take action. I mean, if you start to think about, many countries in Europe have mandatory HbA1c screening for all patients, and ultimately when you start to have that, then what Soren is saying is you're identifying all the potential patients who are at risk, and then you start to develop action plans in treating them, both pre-diabetics and diabetics. And so I think that the dialogue needs to just continue to have more of a sense of urgency because in the developed world you actually don't have as much of an issue of it as you do, say, for example, in the Middle East.
Fantastic.
This is the UR Business Network.